Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, along with my producer, Lindsay, and we are streaming live from the Moses Lake Professional Pharmacy Studio today. And as always, our Monday podcast, we're running a little bit late today, 1 to 2 p.m., and you can catch us on Thursdays, 8 to 9 a.m. Pacific Standard Time. Today, I'm super excited to have Elena with us. She is a naturopathic doctor, also graduated from medical school from Latvia, correct? Latvia. Yeah. Thank you very much. She specializes in hormones, and anti-aging, aging gracefully, also some aesthetics, and she's going to talk about those today. So without further ado, I'm just going to go ahead and, introduce yourself and tell us a little bit about your history. Welcome to the show.
Hi there. I am Dr. Blackburn, Elena. I actually graduated from, like you said, from Latvia medical school, and here I did naturopathic school in Portland. So I do hormone replacement therapy. I do aesthetic medicine. I have interest in anti-aging therapies as well.
Thank you for the introduction. Before we go further, tell us about how in Latvia there was more an integrative approach in medical school, and that's kind of why you went to naturopathic school here a little bit, because there's more of an integrative approach in Europe. Is that correct?
Well, yes, it's correct, but also recently in United States, there's also integrative approach to medical school as well. However, when I graduated, it was a little bit different, and I wanted to know more about nutrition, herbs, and prevention and lifestyle and stuff like that. So I wanted to do that.
Awesome. Love it. Thank you for that. So tell us a little bit about what you do. You practice in Eugene, correct? Correct. Eugene, Oregon. So tell us a little bit about the hormones and aesthetics that you do.
So I do all kinds of aesthetic therapies, from Botox, muscle relaxation, and fillers and PRP, all kinds of different biostimulations, skin, as well as graceful aging requires a good amount of healthy hormones. And depends on the person, depends on the situation. I sometimes prescribe estrogen, progesterone, and testosterone, and cortisol, and depends on what DHA and whatever person needs at this particular age and time.
And so tell us a little bit about aging gracefully. When you say aging gracefully, there's not a way to prevent us from aging. That's correct?
Yeah.
So what's our goal when we want to age gracefully? What does that mean?
The goal is age healthy and age, radiant, and and stay at your prime as much as you want to, as much as you can, considering health conditions, contraindications, and medications. That's what it is.
And so how do hormones affect that?
Well, if the hormones would stay always at the same amount, then we probably wouldn't age, pretty much, right? Hormones are big, large, and very potent transmitters or ingredients that influence our aging process very, very much. So that's a simple answer.
Right. And it is. And as we age, our hormone levels decline. And there is a lot of research and thought about one of the reasons we do age is because of our hormones decreasing. So let's take a typical 50-year-old male that has maybe some symptoms of, maybe they have some symptoms of aging. What would some symptoms of aging be for a 50-year-old male?
Typically, it's fatigue, sometimes decreased erection, hair loss, insomnia.
Weight gain, decreased energy.
Yes,
right.
Definitely. Fatigue, decreased energy, lose a lot of muscle mass lost, and all this kind of different things. Yeah.
Right. So then what would we do? We do with those men? You would check a hormone panel. Is that correct?
Yes, I would check hormone panel. I would check his history and make sure that he doesn't have any kind of situation where he can prescribe hormones. And plus, I would make sure that, first of all, he balanced and remove the obstacles for him to heal and do well otherwise prior to prescribing any hormones, because it's always extra load on your liver, and you need to make sure you're healthy enough to do that, and as long as other things, right?
Right. Hormones are a piece of the puzzle, correct?
Right, correct. Mm-hmm.
Right. And we still have to eat well, we still have to exercise and things like that.
Right. Mm-hmm.
Right.
Definitely.
So, what kind of hormone levels would you check on a male, then a 50-year-old male that is experiencing those kind of symptoms? Can you specifically go into those hormones?
Yes. So I would check definitely testosterone, DHT, DHEA. If there's insomnia, then progesterone, estrogen, definitely. I would check cortisol level, morning cortisol, and if necessary, maybe 24 hours urine cortisol. CRP, because I do want to know where's we generally CRP, it's the inflammatory marker. We'll do CBC, PSA to make sure his prostate works fine. There's no contraindications. Depends on the person, but typically that's probably plus minus. Vitamin D in our area, it's very important because people deficient in Oregon more than other places.
Yeah, absolutely. Yeah, lots of rain and not a lot of sunshine, and we're in the northern latitudes, right?
Absolutely.
Right. So tell me a little bit. I want to back up a little bit. You talked about checking estrogen in men. Can you be more specific than that? I know a lot of our viewers are probably used to hearing about estrogen in women, but not in men. Can you elaborate on that?
Absolutely. So as male aging, his pretty much always, but with age and other factors, his testosterone becomes estrogen, so metabolize into estrogen. And estrogen, too much estrogen can cause so-called gynecomastia, where a male get the symptoms of increased weight, increased breast, increase losing hair, decrease the reaction, and all kinds of other things which prevent him from being in his prime. So the estrogen level should be at optimal level, at least at healthy level for male. For me, I prefer 30 to 50. Some doctors probably prefer more or less, typically more than I do. I think it's optimal, could be a little bit more. But too much estrogen also would kind of contribute to blood clots if there's especially tendency for the particular male to have a blood pressure higher or cholesterol abnormal and stuff like that. Then it's all becomes very kind of iffy point for me to even think about prescribing extra testosterone, which possibly can contribute to estrogen as well.
Exactly. Well, thanks for clearing that up, because I think a lot of people don't know that, estrogen is important in men. So you do need some, you just don't need too much of it. So, yeah. And what about progesterone? You mentioned progesterone and sleep. I know there's maybe some controversy on that, but I'm a big believer in progesterone. Men make progesterone just like women do, not as much as women do, and it does help regulate sleep. So you prescribe progesterone for men, is that correct?
Correct. Sometimes.
Tell us a little bit about that.
So male that chronically cannot sleep and sometimes a little bit anxious, and typically with high estrogen amount, was how I said gynecomastia. All of these symptoms would preclude me, I think, about low progesterone in male, and then I'll prescribe maybe very low doses of progesterone and go. We'll do pretty much clinical trial, because again, like you said, there's a very controversy about the progesterone, to make sure that the other side of too much progesterone would be the anxiety as well, and it's good. Healthy level of progesterone could benefit, but too much progesterone can actually contribute to insomnia and anxiety and stuff like that.
Yeah, that's not that uncommon as far as hormones go. Sometimes too much or too little can contribute to those symptoms. So, And so what about thyroid? What about thyroid for this man? Would you check thyroid?
Thyroid probably would be number one for me to check. I don't know why I didn't say that pretty much in the first row of the hormones. I just forgot. It comes automatically with CRP, and the number one hormone I would check, because that's pretty much the conductor of all hormones in our body. And if thyroid not doing well, then pretty much everything not balanced. All hormones, other ones can be not balanced. Sometimes just doing very little doses of thyroid can help me, and I don't need to prescribe anything else.
Yeah, I think thanks for commenting on that. I think that's so important. When we say hormone balance, I mean all the hormones work together, so you can't just usually balance one hormone and then everything's okay.
Right.
Also, the hormones work in what I like to say a hierarchy, and we can live without our sex hormones. So, whether it be ovaries for women or testes for men, we might not feel the best, but we can live without those. We can't live without a thyroid. So if your thyroid is not in balance, it trumps everything downstream, which means nothing is going to be optimal if your thyroid's not optimal. And then also, on top of that, that means your adrenal glands. You talked about cortisol. Adrenals trump it all. I guess we can live without a thyroid gland, but we wouldn't be very healthy, but we cannot live without adrenal glands. So tell us a little bit about cortisol and the stress hormone and how you check it.
Yes. So it's actually very difficult to check stress hormone because you really have to have no stress for morning cortisol to be accurate. And besides telling patients, don't check your email, try not to stress, drink your coffee, just kind of slowly relocate to the lab. Or best way, it would be just checking the cortisol at home when just woke up and opened your. Now, without stress, people saying is stress bad for me? Well, without stress, we wouldn't live. We have to have stress in order to continue life. But too much stress hormone can make you anxious, can make you gain weight, can make you unhealthy. Inflammation could just rise up. Your body wouldn't function well. Too little stress hormone, cortisol in the morning, can make you very fatigued. You wouldn't be able to wake up in the morning. You would be able to, but you have to put much more effort to it. And your ability to think, to function would be decreased. And typically what I see are people who don't have cortisol in the morning at the optimal level. They do have cortisol at night, kind of higher than normal, and they can't fall asleep. And when they cannot fall asleep, there's different reasons why we can't fall asleep. But if it's related to cortisol, then rejuvenation of our memory, which happens to have a necessity of a low cortisol at night, also not happening. So it's kind of like very, very important. And also the cortisol and DHA has to be balanced and all kinds of other things. And ideas, of course, right?
Yeah. So tell me a little bit about, it's really kind of hard, and I agree with you, it's kind of hard to assess a lab level result of cortisol because of where we are under stress. So you must really look at symptoms and history instead of just trusting a black and white lab. Is that correct?
Definitely. Labs are helpful, but I have patients who actually had been treated with high doses of corticosteroids in their life. They have like 3-4 pages of allergies to medications and stuff. So they have been treated in the hospital in the past. And at this point, they have pretty much opposite reaction to many, many things, including hormones. So their labs are not indicative for me much. So I'm going with the clinical history, definitely, and health history, and the hormone levels as well, right?
Yeah, it's so important to correct those adrenal type issues like the stress hormone before you really can address the other issues. And one of the things is that, if your cortisol is out of balance, usually you're not sleeping well. Is that correct?
Exactly.
And if we're not sleeping well, we talk about it on this show all the time. There's really 3 things that we can do to stay healthy. And that's eat, exercise, and sleep. And sleep trumps them all. If we're not sleeping well, we're never going to recover. We're not going to be healthy. So that's why balancing your cortisol is so important.
Right. Absolutely. I agree with you. It's more important than anything, your sleep. Absolutely.
Absolutely. So tell us a little bit about a woman that's 45 years old. She's starting to cycle more irregularly. Her cycles have become more regular. She might have a few hot flashes, decreased energy, some weight gain. What kind of hormone labs would you run on her?
So on her, I would definitely do thyroid, progesterone, estrogen, testosterone. And I can go ahead and, I'm trying not to go and explain why, because it's just, but cortisol,
Right.
DHA, CRP, vitamin D, HAs, highly sensitive CRP, IGF-1. If it depends on on the symptomatology, what's her goals, but sometimes IGF-1. That's pretty much kind of like general picture, but then each additional symptom would make me maybe think about oxytocin, or maybe think about other things, maybe think about prolactin, maybe think about something else. Depends.
Yeah, it's very, very personal to each patient.
Right.
Let's back up on thyroid a little bit. We talked about how important thyroid was, and you even talked about labs for men and for women. So let's talk about thyroid labs specifically. I know usually the gold standard of thyroid is TSH alone. Do you get more specific tests than just TSH alone?
Yes. I'm definitely not a fan of providers who just prescribe TSH, just because it doesn't give me enough opportunity to understand if it's what is going on. Because sometimes TSH itself can be normal, but in normal limits, but person would have subclinical hypothyroid situation, and free T3 and free T4 would be very important to detect, and as well as if we're talking about an autoimmune situation with Hashimoto thyroiditis, and it would be important for me to see the thyroid antibodies. So 2 groups of thyroid antibodies, definitely.
Tell us a little bit more about Hashimoto's. We have not talked about it on this podcast much at all, but you talk about antibodies to your thyroid and Hashimoto's. I know I've read some reports that up to 50% of thyroid dysfunction could be related to Hashimoto's. Tell us a little bit about Hashimoto's.
So basically, Hashimoto, like I was recently explaining, and it's funny because with practice, with years of practice, it always comes to your mind different explanations, simple and simple. So the last thing I explained it, I said, it's not really against you wouldn't really feel antibodies against your thyroid, but it's basically not a stable levels of your thyroid hormone. That's what happens, and that's what you feel, up and down, up and down. You're feeling anxious, you're feeling depressed, you're feeling anxious, depressed, you're feeling tired, you're feeling manic almost. And that's what Hashimoto does in symptoms. And why is it happening? Well, there's so many theories why, but even though we will fix everything and person would be absolutely healthy and doing everything right, still there's going to be typically antibodies present. The amount of it, that's what makes a difference. If it's, if you will get from 1,500 to 10 TPO, thyroid peroxidase, then anti-thyroid peroxidase, then the person would feel much better. But what it is antibodies to your own thyroid gland, basically. And right.
You're trying to basically attack your own thyroid gland. So how do you treat that? You just treat it more aggressively with thyroid and maybe some diet issues? How do you treat that?
We, first of all, I'd like always start with eliminating the factors which can contribute to thyroid problems, as the sleep, as the diet, healthier lifestyle, amount of nutrients necessary to build those hormones, thyroid hormones, everything. And then I would not say more aggressively. So no to more aggressively. I would say actually more precisely, more patiently,
Right.
and more kind of paying attention to all little things, every other hormone, assessing everything, and then maybe adding, changing stuff, because you have to really look. It's not just hypothyroid when it's Hashimoto. It's just a general dysfunction, whole body dysfunction. So there's something that contributes typically.
Right. There's basically a lot of inflammation probably going on in the body is really what it is. And you have to really address that whole issue and treat the problem and it's just a symptom. So we want to treat the problem instead of just a symptom of Hashimoto's, correct?
Absolutely. Our body doesn't know anything else. They just know how to react with one thing, inflammation. Whatever happens, we don't sleep, inflammation, we are thyroid non-function, inflammation. So yes, inflammation would be the main. That's why I check HACRP to actually see where I'm starting with, but then I'm going to optimize in inflammation to keep CRP and mild levels, definitely.
So what about CRP? Tell us how you lower CRP. I know that's a pretty big buzzword right now about CRP and inflammation and monitoring it. And if we do have elevated CRP, you're at bigger risk for having a heart attack, correct?
Correct. And cardiovascular and brain.
And stroke. So heart attack and stroke. So what are some ways that you can lower CRP?
I don't know. You probably would be laughing right now on our because I actually use very simple levels, very inexpensive ways to decrease CRP. And typically it's a diet. It's my favorite vegetable soup, which I recommend to everybody. I'm like, okay, that's very easy. There's my recipe. And bromelain and turmeric, those kind of things.
Yeah, no, those are great.
Yes, there's 3 things. And if people do that, then their CRP goes tremendously down. Like give me 1 to 3 months and it'll be much better.
So bromelain, turmeric, and what was the other thing? Your soup recipe?
Yes, my soup recipe, my vegetable soup recipe. Very simple, right?
And is there any magic ingredients in it? I don't mean that in a bad way. It's just what's the secret ingredients in it? Is it just vegetable soup?
Yes, vegetable soup. Basically, there's no meat, right? And so there's carrots, celery, herbs, tomato. I don't know. Pretty much whatever you have in the fridge, all vegetables, and cauliflower and broccoli, everything goes there. And you just steam it for a little bit and then eat it during the day. You can eat it, even drink the broth, vegetable broth during the day as the drink. So that's what I recommend.
Just those 3 things to lower CRP. I love it. You say I'm going to laugh, but I love it. I mean, when you think about our bodies are created to, we don't need fancy drugs a lot of times to take care of our bodies. We just need to know what to eat and exercise and sleep. So you say I'm going to laugh, but being a pharmacist, my wife and I are both pharmacists, and we talk about therapies like this all the time because I think if you can do nutritional therapies with diet and lifestyle changes, it's much better than drug therapy that has side effects.
Right. One thing I have to mention, of course, we're talking about when there's no organic issues, no problems with acute inflammation on infection, because when CRP of 10 and higher, then you have to rule out any kind of, infection.
Correct.
Right. It's number one thing. And then when everything ruled out and it's just functional problems, then.
Right. Thank you for clarifying that. Because yes, that is so true that there could be an underlying infection, and obviously, we got to treat that before we can really look at the bigger picture. So, thank you for that educational tip. That's awesome.
Sure.
Okay, so let's shift gears a little bit.
Right.
You do some aesthetic stuff also,
mm-hmm.
And you're a poster child for that. You look great, by the way. I don't know if you do aesthetics, but you look great. So, anyway, you do some Botox, and you do Botox for aesthetics, correct?
Correct.
So tell us a little bit about Botox, where you get it injected, and how that works for aesthetics and wrinkles.
So the Botox, Xeomin Botox, Dysport, Juvea right now, it's a new Botox, and there's one coming almost came FDA approved, which I'm not going to talk about, but that's the one longer term kind of neuro modulator, muscle relaxant. So all of them works pretty much similar. They prevent release of neurotransmitter in the muscle, so blocks the connection between nerve and the muscle, and this way, while wrinkles kind of softer and relaxes the muscle, which we use to make wrinkles. So just make our facial or whatever muscle we're injecting it into lazy. Right, so we can inject it in our forehead, in the glabella right here to relax those 11s, around the eyes. Sometimes I inject it on the upper lip to just relax the vermilion border. We can prevent developing of marionette lines right there, right here, but it's just not very. It's not FDA approved, but sometimes patients asking me. So all kinds of things like that. And other places, of course.
Yeah. Okay, that's awesome. Now, how long do Botox injections last? They don't last forever. How long do they usually last?
They last company says that they last from 2.5 months to 4 months. Some people can stretch it to 5. However, I think with aging, it's lasts less.
Not quite as long. I mean, that kind of makes sense, right?
Right.
A little bit. I mean, our wrinkles are probably getting a little more severe, so it's not going to last as long.
And of course, the amount of it is important. So the more you inject, the longer it will last.
Right. And you have to be careful about how much you inject, correct?
Correct. And typically East Coast and West Coast very different on amounts, because my books are, which typically written by East Coast doctors, they are much higher amounts they injecting there than we are injecting here, probably because we want it to be more natural. People are asking me that their facial features wouldn't change and stuff like that. So I'm making sure that's happening, right?
Great. Well, thank you for clearing that up. Thank you for educating us on that. And what about fillers? So what are fillers? You talked about fillers and you do fillers. What are fillers?
Fillers are liquid skin, I would say. Basically, when we're losing our volume in our skin and under our skin, we try to replace it with hyaluronic acid, calcium hydroxyapatite. In the past, it was collagen. Right now, it's not important, the collagen as much, because we cannot reverse it. With hyaluronic acid, it's easier to reverse. So basically, we can inject and we can reverse if it's too much. It doesn't work very well or any side effects.
And so tell me a little bit about fillers. You inject them around the lips, correct?
I can inject fillers pretty much everywhere. Because recently I was introduced and actually have a second part of the training of doing a biostimulation with hyperdiluted radius, and it's actually not only face but also body, arms and buttocks and legs and everywhere. So in the face I injected temples and lips and around the lips and cheeks and everywhere, and sometimes under the eyes if people ask me to, and if it's indicated, right?
Yeah. Thank you for clearing that up. You're educating me as well as our viewers. I like it. All right, Elena, we're wrapping up the podcast here today. So I've just got a few questions for you. Actually, the first one is, what drives you? What do you have a passion for?
I have passion for help and make people beautiful, or healthy and beautiful, definitely.
Awesome. So how do people get a hold of you so they can be healthy and beautiful?
They either call me, text me to our phone number in clinic, or they send email.
Awesome. Producer, can we stream her? You got something ready to stream, like her email or something? We're going to stream your website or something, I think, up there so people can know how to get a hold of you. Well, I appreciate that was a lot of information in 30 minutes. I really appreciate you coming on today and educating our listeners and viewers. And there she is. There's how you get a hold of her. Elena, thank you so much for being on today. I really appreciate it.
Thank you very much.
You're welcome. All right. You've been listening to another edition of Health Solutions with Shawn and Janet Needham. Tune in Thursday, 8 a.m. to 9 a.m. Pacific Standard Time, because we will have Lorraine Lanning on. She's going to tell us about her experience of COVID, how she contracted COVID and fought it and won. And she's also going to tell us about her journey of weight loss with a keto diet, losing 70 pounds. So tune into that. You don't want to miss it. As always, look us up on YouTube, the Health Solutions with Shawn and Janet Needham. Subscribe so you don't miss any episodes. And we are on all the podcast forums. So iHeartRadio, SoundCloud, iTunes, Stitcher, Google Play. Go to your favorite podcast and listen to us there. Watch us on YouTube. Subscribe. Elena, thank you again. And listeners and viewers, as always, thank you for watching. You've been listening to Health Solutions with Shawn and Janet Needham.